Welcome to our media briefing today and our public access. We welcome those who are joining us on the internet and invite you to send any questions you have through whatever means we provide. Texting, Pinterest, all those social media outlets. Really, we've got Senator Christensen in here today to talk about Medicaid expansion a little bit. That's an item that we'll be discussing in caucus. Maybe we'll turn some time over to him to maybe preface some remarks before some questions.
Be more than happy to. As the Senate Chair of the Health Reform Task Force and the Social Services Appropriations Task Force, I am particularly primed to talking about the dollars that social services cost us. For months now, we have been considering various plans on Medicaid expansion ever since Obamacare was passed and that option was given to us. The courts said that it had to be optional through the states, and so half of the states have jumped on the bandwagon and half of them have turned it down. I would like Utah to be another one of those that turns that expansion down. There are those in both of the bodies that want something done and not just plain turn down and say no. My plan, my bill that I'm offering, Senate Bill 149, is it? 54? One of those, mine. It's called Access to Health Care. We didn't put Medicaid in there because that draws lots of attention. But my bill proposes to provide access to health care through traditional Medicaid to the most needy of the group below 100% of poverty. I'm particularly aware of the cost, and I want to provide the care to those who really, really need it, and still provide some dollars left over in the budget to take care of those people who can possibly get along without it, like they have done forever. They have never been entitled to health care or food stamps or so many other programs, social programs that are out there. But I have been called a significant number of names for my cold-heartedness. I merited this beautiful attack flyer that was sent to everyone in my district that gives me the credit for stopping Healthy Utah. I don't know that I deserve all that credit, but if you ever promise someone anything, you don't have to give it to them. You just have to promise it to them, and then don't deliver. You are the devil himself. On the other hand, if we give it to those people, Healthy Utah, for example, for 3 years, and then the governor says we can back out of it, I feel like I would just about need a bodyguard if I voted to back out of it after having given it to people for 3 years. I support my option. I think it's sustainable. I think it will leave some dollars for all of those other social services requests that we have. I've got about $100 million worth of requests in social services. Healthy Utah, under the current proposal, will take every available dollar from everywhere. Will leave nothing for all of those other people who really, truly need it. Everything else I have to say is mostly negative about Healthy Utah, so I'll leave that for someone else to report on. Be happy to answer questions.
So we also have Senator Sheena Zhao here, who has SB 164, which is the bill to provide for the governor's Healthy Utah. And we talked about that here in press availability a couple of days ago. So you now have two bills that the Senate is proposing. We're going to be talking about those in caucus today, and we'll take any questions at this point.
Where do you lean line amount of what it would cost by, I think, 2021, what each of those would cost? Do you know those numbers?
$78 million for Healthy Utah, $28 million for my favorite title, Frail Utah.
For your bill, yeah.
Mm-hmm.
Ben, you have a comment?
Yeah, where do you come down on it? Which bill do you support?
I mentioned to Bob yesterday, and this was reported in Utah policy, that my objective is to try and find a way that we can cover the gap, those who are not insured. And right now, there's really only one viable possibility, and that's the Healthy Utah proposal, but I'm not shutting the door on other options that might come that would meet that coverage gap. The Senate passed a bill out last year with Senator Shizow's bill that did cover the gap. We were hoping to get a 90-10 and participation from the federal government, 90 federal government, state 10, but the feds didn't bite on that one and would not allow that. We could do 70-30 on that, but that cost $50 million more than Healthy Utah. And so what we called the Senate plan last year, which was really the task force plan, is going to cost more, and that's why I've kind of concluded that, you know, we've got to, if we're going to cover the gap, you know, I'm open to some other ideas, but right now there's only one program out there that we can debate that covers that gap.
Do you expect that the House will come around, or do you think that this is going to not happen again?
Well, it's hard to predict, Ben, that what will happen. I'm not even sure what's going to happen in the Senate, and we're all keeping an open mind. We're going to go into our caucus today and have a discussion about this, and everybody has the right to speak their piece and their mind, and they represent their constituency, and those voices will be heard as we deliberate, where we might go, and I suspect that, you know, we'll leave caucus today with potentially more discussion that will need to be had before, you know, the final outcome for the Senate is going to be determined. And then again, you know, whatever passes here in the Senate's got to pass the House.
Do you expect, though, that anything will happen this year? Do you think this is, or is it going to get kicked off for another year?
I can't predict that. That's very difficult at this point.
Senator Christensen, I understand there's some brief presentations tomorrow on these plans in, I think, social services appropriations. I'm wondering how you see those playing into the broader discussions that are going on, since they are so brief.
Everything's going to be brief in social services because we've got so many things on the agenda. So the presentations are going to be made.
Once the bills are decided upon, then the Social Services Committee will have to deal with those appropriations. If we do Healthy Utah or another plan that's that expensive, that'll save us a lot of debate on the other items because there won't be any dollars left over for all of those other requests.
This is just kind of preliminarily laying out the various costs of each proposal?
It's our job to discuss all of the appropriations requests from the highly unlikely down to the absolute mandatory, and so all of these requests are going to be discussed so that they'll be on the table.
Senator Christensen, if cost is such a big factor to you, why propose anything at all? Why not just keep it the way it is?
That's a good question, and that's what many of my colleagues are supporting, is do nothing at all. They don't want more people put directly under government control, and health care paid for by the government is government control. Whether we like it or not, it's a fact. And so many of my colleagues, those that are very conservative, the ultra-conservative, don't want to do anything at all with it. That's the third plan.
Other questions?
Yeah.
Senator Shizow.
One thing that I just want to emphasize too, we talk so much about the cost that it comes to the state, whether it's under a Healthy Utah plan or say a plan that covers only 12 or 20% of the medically frail. But also as part of that necessary discussion is how much more one particular plan or less will bring back to the state. For example, under a 12% medically frail proposal, we might leverage back, say, $300 to $330 million, Whereas under a Healthy Utah plan, we would get almost 10 times that, $3.2 billion. And so that's a significant benefit to the state of Utah that will go to hospitals, providers, to the general economy, and has the downstream business economic benefit as well. So that should also be a figure as we look in not only state expenditures and what might cost the state in taxes, but also balance that with the revenues. Then with that, and things that are yet to be decided, are going to be participants who will come forth under a Healthy Utah plan who would be willing to also help defray the costs. We can have that discussion at a later date once those issues become clearer. First of all, what we've got to do is pass the Healthy Utah plan, and then we can talk about more about those precise methods of funding.
Participants meaning a hospital tax of some sort.
That's been an active and ongoing discussion about a provider tax. That's been done in other states with significant success in defraying the costs. But again, that's something that will depend basically on the passage of these bills, and so until that happens, that's not really a point that we can delve into much. But that is going to be germane to the conversation once that bill passage happens.
Given what Senator Christensen said about a lot of colleagues support do nothing at all, any ventures on the odds of your bill succeeding?
Well, I'm always optimistic about this particular plan. I think it's a good plan. And to paraphrase the governor, I think of the choices, none of these are perfect. But this makes the best choice of the options with which we have been presented. And so that's why I present this. Now, if I were sitting back and saying, I believe this is a good, rational, sensible plan, and then I would plead with all my fellow senators, including my good friend and colleague Senator Christensen, to embrace this plan, though he may have other ideas.
He does.
Obviously.
He does. You can quote me, I have other ideas.
So if your bill passes, it says go get a waiver. I guess all of the bills right now say go get a waiver. We're still talking 3 or 4 months after the session before we see something like that.
At best.
Is that about right, or are we?
It's going to take some time. Now, the one advantage of the Healthy Utah plan is so much of the groundwork has already been laid with the government, face-to-face discussions with President Obama, the Secretary, and others, so that this framework is already in place. And in fairness to the other plan, while there have been some preliminary discussions, these sorts of waivers would have to be further negotiated and precise definitions obtained before that could go into place. Now, how that would affect the timeline of implementation, I can't guess. But given one that is already farther down the road with some preliminary agreements, you could surmise that this would go into place much quicker and much smoother.
Though other states have implemented partial plans like mine, one of the problems is the federal government bounces around. They told us absolutely no caps on numbers or dollars. Yet a couple of weeks ago, they okayed a Virginia plan that put a $20,000 person cap on the plan.
Is it 20,000 person?
Persons.
Yes. Yeah.
20,000 persons. They put a cap on Arkansas on dollars, which Arkansas proceeded to exceed, and then they just kind of said, well, we'll ignore it. So they're paying more than what they were told they could. So it's a work in progress.
Any other questions on other issues? Any from our viewers?
I have
Yes.
a question about Representative Oda has a bill that would, it's the constitutional carry for anybody over 21. It was one we had 2 years ago that the governor vetoed. The governor says he still has the same feelings on the bill. I'm wondering, is there support for passing this again if the governor might veto it again?
Well, that's a bill that we haven't even discussed. It's a House bill. I think that as it gets closer, we'll probably have some more discussion on it. So I really don't have much of a comment on that today. I'd like to have a discussion with my colleagues and see where we're headed with that. Okay, thank you very much.
Thank you. Thanks, guys.
Thank you, President.